Thank you so much for that lovely introduction. For some reason, we can't get my video to show, which is too bad, because I'd love to see you guys and for you to see me, but I am here live. And after the presentation, there will certainly be time for questions, and I welcome that. I'm really excited to be speaking to you today about PEMF, pulsed electromagnetic field therapy, for your feathery, scaly, and small mammal patients. So I hope we have lots of exotic vets in the audience tonight, and excited to speak to you about this therapy I use routinely for my patients. And I get very excited when I get called by the exotics department to see these patients. A bit of a summary for what we're going to cover today is the challenges that we face in treating exotics and why this particular modality may be especially helpful for treating exotic patients. We'll review briefly, I don't want to bore you, but I think it's important in understanding why the therapy is so effective and understanding the background and its mode of action. We'll cover very specific applications for exotic patients, and we'll talk about a lot of specific cases so you'll get lots of ideas of what types of conditions could respond well to the loop. And then finally, I will give you very practical information for some treatment recommendations. So here's just a sampling of the types of patients that we're going to be talking about tonight. You can see in each one of these pictures, they are severely ill. They are not presenting with the first symptom of illness as we often see in dogs and cats, but these animals have probably been sick for quite some time and may be on the verge of death. You can see this bunny on the upper left is just looking very, very sick, hiding behaviors, not socializing anymore, not eating. These are all signs of pretty advanced illness in these species that are very good at hiding their illness. And so that really is a point about the tools that we can use in helping our exotic patients, is that a lot of times these species are presenting to us in the clinic at the end stage of their disease. And handling them in particular can be, really, they're in a fragile state. They can hide their illness, as I said, for many days. And sometimes when it comes to reptiles, it could be for months. They may not have been eating for days or weeks. And, you're really at risk for having a poor outcome when they present to you in such a grave state of illness. So how can PEMF help you in the clinic and help these patients to potentially improve their outcomes? The other topic that's relevant in exotics is the pain medications that are available. The bioavailability, as we understand in the species that we're speaking about, reptiles, birds, small mammals, the bioavailability data is often not available. In some cases, we have it for birds and rabbits, but a lot of times, particularly in our reptile species, and certainly in the wide variety of the particular species that we see, like within the avian species, there's a lot of different types of birds that likely metabolize drugs differently, and also within the small mammals. So the type of data that we have on pharmaceutical drugs in small animal medicine is not available to the same degree in exotic animal medicine. In addition to not understanding how bioavailable the drug is, we also don't know the safety of those medications in many cases, and also efficacy. Like, do they even work? I think a good example is tramadol in dogs. We were using it so frequently to treat pain until we discovered that dogs don't metabolize. They don't make the M1 metabolite like people do. And so tramadol is not a good pain reliever in dogs, whereas it's great in cats. And, how is tramadol in birds and in rabbits and reptiles? I mean, we just don't have the level of information for a lot of these species. And also we're faced with the difficulty of administering these medications when they are at such a fragile state, as I said, at the end stage of their disease. And so it can really be a challenge to effectively treat pain in these species. So I have a quick little polling question for you guys. I am curious to know who is currently using the Assisi loop on reptiles, so snakes, turtles, or any other reptile, bearded dragons, etc. How many of you are using it on birds, rabbits, or small mammals? So you should have, it should have popped up on your screen, and you can just click to help make this nice and fun and interactive. Let me know which of these species you are currently using the Assisi loop on.
Dr. Alvarez, I do see the poll. I'll give it another maybe 5 or 6 seconds to get the results in for you.
Okay, cool.
And there should be your results.
Awesome. So, well, I'm pleased to see it seems that all of you are using the Assisi loop currently on exotics, which is awesome to see. And most of you are using it on rabbits and other small mammals, so which makes sense. Hopefully by the end of today's presentation, you'll be using it also on your reptile species and avian, because I would say in particular, those are the ones that are more difficult, I think, to address their pain. Okay. So let me just give you a little bit of background about PEMF and why the therapy works. So I'm going to back you up just a little bit. When we are talking about electromagnetic fields, this is something that is present in all living things. So all atoms and all cells in the body produce electromagnetic fields. And in fact, every organ in the body produces its own unique bioelectromagnetic field. And cells communicate via this biological electromagnetic field at all times of the day. Trillions of cells, literally like 70+ trillion cells, are communicating today in your body via electromagnetic signals. And you can think about, I mean, you've learned about this, for example, in conduction of muscles and how the heart functions. You know, electricity is something that we know our bodies are sensitive to, but I'm not talking even about something like that to that degree. These are biological voltage signals that cells are using in order for ions to cross the cell, for example, and in deciding which neurotransmitters are released at the cell membrane. So this is very, very closely monitored in the body, and the cells are communicating at all times via these biological electromagnetic signals. And the tissues are very sensitive when there are changes in this electromagnetic activity. And that is, in fact, what these pulsed electromagnetic fields are tapping into. They're tapping into these biological fields that are already present, and they are targeting those systems that already exist in the body. And we know specifically for the Assisi loop, this isn't true for all PEMF devices, and we'll speak a little bit later about the differences between some of the devices that are out there. But in speaking about the Assisi loop specifically, what is happening is there is an upregulation of the voltage-dependent binding of calcium to calmodulin. Now, calcium to calmodulin is involved in an inflammatory cascade. So when calcium binds to calmodulin, that induces production of constitutive nitrous oxide synthase, and then you get production of nitrous oxide, which has an almost immediate effect on vasodilation. So this happens literally within seconds. And this calcium calmodulin, nitrous oxide, and then cyclic guanosine monophosphate, CGMP, that complex is going to lead to down regulation of interleukin-1 beta, which is an inflammatory cytokine. And then that then also leads to decrease in inducible nitrous oxide synthase. So there's two different kinds of nitrous oxide. There's the good kind and the bad kind. So good kind is the constitutive that is in our bodies that helps to regulate inflammation. But if there's trauma to tissue, we get an upregulation of inducible nitrous oxide. So it's induced by trauma. And this cascade of the calcium calmodulated nitrous oxide cGMP is going to downregulate that inducible nitrous oxide synthase. You get increase of your growth factors such as VEGF and FGF2, as well as an increase of angiogenesis. And all of this really comes down to improving tissue regeneration and remodeling. So that's really how this works, is the PEMF is going to act on upregulate the already voltage dependent binding of calcium calmodulin. It's going to upregulate that. We're going to get vasodilation within seconds, and then within minutes, and then we'll go on into days and weeks, you have an anti-inflammatory cascade in the body. Okay. All right. And PEMF isn't anything new. This has actually been around for over a century, but it has gone through different phases of change. You know, back in the early 1930s, PEMF was sort of reborn, rediscovered, because previously these machines created heat. And in the 1930s, they took these diathermy machines and they developed them in order to not develop heat anymore, basically by lowering the duty cycle. So these radio frequency devices were heating deep tissue before, and they were adapted in order to no longer produce heat, which made them essentially a lot safer for use. And then in the 1980s is where there was really a boom, because there were some clinical trials, some really meaningful trials actually out of Columbia Presbyterian, where they were looking primarily at human patients that had non-union fractures and failed arthrodeses. And these studies demonstrated really incredible success rate by using these, what actually were called bone growth stimulators, where they saw improvement of up to 81% in these patients that had ununited fractures and failed arthrodeses. And it was through those studies that FDA was approving these devices. So basically, beginning as early as 1979, these PEMF devices had FDA approval for use in human use. And then since then, there's even been more development, where in the 1990s, we saw a shift from these bone growth stimulators, which are really big and bulky. They almost look like C-rings, like a CT scan. And then they were further modified in order to make them portable. And so now we have not just portable, but also targeted. So this magnetic field is much more targeted now to specific tissues. And the FDA approval is for treatment of soft tissue pain and edema anywhere in the body. So that is what the FDA approval is for the Assisi device. Okay, so now that we talked about all that science and all that boring stuff, I wanted to give you some real life examples of the species that we're talking about tonight. So this was a really cool patient that my colleague, Dr. Cindy Brown, reached out to me about to help with. This was a duck named Chip who had an open fracture in his digit, as you can see there. And he developed osteomyelitis. It was really nasty. You know, he really wasn't using the leg. It was causing significant pain. And so what we did is we did a series of, we did some shockwave treatments, and then we also did PEMF. And you can see how easy it was to treat him, because all he had to do was to just put the device underneath him, and then he's just standing like he normally would. So really easy to use. And so he got this treatment multiple times a day. And then voila, look at the improvement that we got. He actually required no surgery. This was treated completely conservatively and had a really wonderful outcome. And what's really nice is that owners were able to take this device home and continue that therapy even when he wasn't getting treatment in the hospital. Okay, so that's bone healing, right? That's how this device was initially developed. But what about wounds? So we know that in addition to helping bones to heal better, it also helps wounds to heal better. And it's because what we already spoke about, the PEMF's enhancement of the anti-inflammatory cascade and nitrous oxide signaling. So we're going to get a lot more blood flow to the area. We're going to get reduction of our pro-inflammatory cytokines and an increase in our growth factor. So just all the stuff you need to clean up a wound. This is another case that Dr. Cindy Brown was treating at the Animal Medical Center. This is a really severe case of cheilitis in a guinea pig. I mean, you can barely see this poor guinea pig's mouth. It's so distorted by the severe fungal and bacterial infection. And so in addition to, using antifungals and antibiotics, she initiated PEMF treatment. And you can see already the remodeling as she started the PEMF treatments. Now he's starting to look more like a normal guinea pig. And then finally back to normal. So pretty amazing. And, why I'm including this in wound healing is when you have severe infection like that, the barrier in the skin is no longer there. So all of that, natural immunity that we have in the dermis has been broken through by the infectious organisms. And so bringing in that blood flow, bringing in those growth factors can really help infected wounds to heal better. And again, see how non-invasive this is. You can just put that loop entirely over the guinea pig's body and it's not interfering with them. It's not a stressful treatment. You're really not doing anything to them. They're just sitting inside the ring. This is another case that we saw relatively recently. This is a 1-year-old Juliana miniature pig that was unfortunately attacked by her dog that lives in the same household. It was a Belgian Malinois that attacked her. And you can see from where the wounds are, I think that the dog was intending to kill this precious little pig. So it's severe wounds to the neck region. And, while there was talk about putting in drains and doing a lot of wound care management, we decided to try the PEMF on her and look at just within 48 hours, she had significant improvement. So no drains were placed. Of course, there was a lot of cleaning of the wounds externally, but no surgery had to be performed. And she tolerated this so nicely because she could wear the loop essentially like a necklace. And I have this little cute video because she was just so adorable. You can see she's just, walking around, doesn't really know she's receiving a treatment. She's just eating her treats while she's getting her PEMF treatment. Look at her, she's so cute. But her whole demeanor changed when we started the PEMF treatment because she was, of course, experiencing a lot of pain from all of those wounds that she had. And the PEMF, again, was something that the owners were able to take home and continue. Okay, so now that we've spoken about a couple of examples that I think would respond well to PEMF therapy, I want to make sure that you understand that not all PEMF devices are the same. So one thing for sure is that if the device is FDA cleared, it has to have the short wave, which is 27.12 megahertz. Okay, so you might go, for example, into CVS and you'll see there's a PEMF and it says FDA cleared or FDA approved. That, though, doesn't mean that the device is the same as what I'm talking about tonight. And the reason is the technology in these PEMF devices is wide ranging in the characteristics of the pulse itself. So, for example, the waveform pulse width, as well as the pulse frequency, the duration, all of that, as well as the size, geometry of the antenna, is going to have an effect on the actual electromagnetic field that's delivered to that tissue. And so those characteristics of the pulse frequency, duration, amplitude, size, and geometry of the antenna are going to determine the magnitude, really, of the electromagnetic field and will ultimately determine the safety and efficacy of the device. So here's a nice example that was published in the Gaynor paper in Veterinary Science in 2018. Where we have results from two different studies. One was looking at a non-targeted PEMF device. So again, both of them have that same shortwave frequency, the 27.12 megahertz. But the non-targeted device is delivering a 100 microsecond pulse width with a 1000 hertz pulse frequency. And it was delivered for 12 hours daily. So you're like, wow, that must really be doing a lot, right? That's getting so much treatment. But the VAS pain scores that were measured in that study reduced by only 25%. And then you take the targeted PEMF device, and this is the same frequency as the Assisi loop. So we've got that 27.1 megahertz wavelength that we need for our FDA approval. But now watch, the pulse width is actually much shorter. It's only 2 microseconds, and also a much more rapid frequency with 2 hertz pulse frequency. And it was only delivered 15 minutes twice daily. So much shorter treatment, yet essentially the electric field was approximately 7 times stronger in this targeted PEMF device compared to the non-targeted device because of the difference in the pulse width and the pulse frequency. And you can see that also in the results of the study, because these were humans suffering from knee osteoarthritis, and their VAS pain scores were reduced by almost 40%. So big change in the outcome in these patients with knee osteoarthritis, even though the targeted treatment was much shorter. They were only doing it for 15 minutes twice a day. So I just want to make sure you understand that, because there's a lot of PEMF devices out there, and you really want to ask questions about the studies that have been done on those devices and whether they can actually demonstrate safety and efficacy. Because to my knowledge, in veterinary medicine, we only have that data for the Assisi loop. Okay. Back to some more examples. This is Dr. Latoya Latney, another wonderful colleague of mine at the Animal Medical Center. This was a bearded dragon that she treated post-op ovariorectomy. And Dr. Latney told me that she really uses the PEMF post-operatively in all of her patients. And she said it particularly for reptiles because the pain medication options are so limited. So this bearded dragon did really, really great after her ovariohysterectomy. And then this is a sweet, sweet green conure named Bird that had surgery to remove a squamous cell carcinoma on her tail. And then she went into cardiopulmonary arrest 3 times in the OR, and then she developed a tracheal plug. I mean, it was really, really in bad shape. She needed to have an intraosseous catheter placed. And so they used the PEMF device to reduce the swelling associated with the tracheal plug, as well as to reduce intracranial pressure and edema that had developed post the cardiopulmonary arrest. And again, see how easy it is to administer this treatment in this very, very fragile patient, you know, who's just hanging on to dear life. And in addition to the other therapies that she's receiving, we could just put this ring around her whole body, put in, you know, just touch the power signal, and we're delivering this therapy that's going to increase blood flow, reduce swelling and edema, and improve pain management. Here's another example of a bunny named Chobi, who had had a facial abscess that had to be resected from the jaw. So it was really, really severely painful. Also developed a seroma post-operatively. So you can see we use the PEMF here to help reduce that swelling, help to improve pain management. So really easy to administer therapy. And this was a really sweet chinchilla that had multiple oral extractions. It had a lot of impactions and teeth that had to be extracted. And you can see this is actually common in the exotics department, that I get called down to help on cases, and I'm doing the PEMF therapy in conjunction with acupuncture. So you can see I was doing acupuncture therapy on this chinchilla while also doing the PEMF to help reduce that swelling and improving pain. Here's another example where we're using it for oral pain and in a post-dental. So this was a rabbit that again had some extractions and was having some difficulty eating after the dental. And so we used the PEMF device to help with the pain management. Oh, I think that was a little video. Let me show you the little video. Yeah. So very well accepted by the patient. And this is another rabbit, again, post-dental, that we're using the PEMF. So, you know, if you're getting the hint, that's nice adjunctive treatment for your patients post-dental. Okay, the other category, and I'm sorry that I don't have more cases to show you on this one, but one of the things that, you know, it is described anecdotally, we don't have studies on this, but anecdotally is for feather picking. And so beyond the anxiety that might be related to feather picking, you know, there's obviously trauma to the dermis itself. And that's really where I think the PEMF may be helpful, because we're going to bring blood flow to that area and help to reduce the changes that had happened to that dermis. And, you know, a little bit of, it's like once you start scratching, you start that response. And so that OCD part of it is like once they start feather picking, then they continue to do it because of that sensation. And so the PEMF can really help to reduce some of that sensation that they're feeling that makes them want to do it again. I will say that Assisi has another device that's been marketed for dogs called the Calmer Canine. And that signal, which is different than the Assisi loop, is specifically for reduction of anxiety. And while I haven't done this, I would encourage you to maybe try the Calmer Canine for the feather picking birds, because it might specifically address their anxiety. So it works in the amygdala part of the brain and could help to reduce anxiety. But as far as inflammation and bringing blood flow, the Assisi loop is a good choice for feather picking. The other one that we've seen success with is for GI stasis. And again, reason being here is that you're improving blood flow, and a lot of these animals are in a lot of pain, right? So we know that these herbivores need to be eating at all times, just like horses do. And if they stop eating, you know, they're really at risk for developing a lot of really severe systemic illness. And so to return blood flow to the gut and to manage their pain non-pharmacologically, because remember, when you have GI stasis, you're going to get a lot of decrease in absorption of your oral medication. So to be able to provide a non-pharmacologic form of pain relief is particularly helpful when you're dealing with GI disorders. And this was another really cool case that I helped with. This was Spanky. She was a blue and gold macaw that had some arthrosclerosis, and then, you know, basically suffered a stroke event. She couldn't stand, she couldn't eat on her own. I mean, it was looking pretty dire. This picture here was taken when she was just lying on her side. She couldn't stand up. She couldn't walk. She wasn't eating, so she was being tube fed. And I did acupuncture on her, and we actually did some rehab exercises with her as well, and in addition with the PEMF. And I'll show you here after a couple of days of treatment. Look at, she's now able to sit up by herself, and she was able to even turn her head a little bit more because she'd had a head tilt after the stroke. And then she started to be able to take food in her mouth.
So good. Oh, good.
And was just really delightful to help her, again, in a non-invasive way. And I did want to make the point, you know, you've seen a couple slides where you see acupuncture needles in the patients, and in Spanky's case, you know, we were doing also rehab. And, you know, I don't want you to get the sense that PEMF is just going to be the panacea for treating every problem in exotic species. It's really an additional tool in your toolbox that can help with the strategies you're already using with your patients. But certainly, particularly when you have those severely ill patients that are difficult to handle, we don't have great options for pain medication. The PEMF can really be a wonderful adjunctive treatment. Okay, so we've been talking a lot about pain management. I want to give you a little bit more data about the Assisi loop in particular. There were some really excellent studies early on that gained a lot of acceptance for the targeted PEMF device. And this was in women who were actually recovering post breast reconstruction surgery. These were women that had mammary carcinoma and then had breast reconstruction surgery. And what they looked at here, these were double-blind, placebo-controlled studies where half of the women received the PEMF treatment. It was actually bandaged on their chest and set on an automatic setting. And then the other had a sham device, so they were truly blinded. And what we see is a nearly threefold faster recovery in pain management. So we see the pain drops 3 times faster in the group that's getting the PEMF device. And in addition to that, you see that the postoperative control is 4 times higher. They have better pain management 48 to 72 hours post-operatively in the active group. So much lower pain scores in the active group. As you see on the right there, you can see that they have much lower VAS pain scores compared to the sham treatment group. And in addition, they actually measured this interleukin 1 beta, which is a highly inflammatory cytokine. They measured that at the wound site, and it was decreased by 40% in the group that received the PEMF device compared to the sham device. And then in addition to that, and this will be really interesting when I talk to you about the study that I did at AMC, is that they saw a reduction in narcotic use in these patients by 50%. So the patients that were receiving the sham device required 2 times more narcotic medication to manage their pain as compared to the treatment group. Okay, so that's going to bring me to our next polling question, which is dealing with pain management and reptiles. So the question I have for you guys is, which NSAID is the most effective for treating pain in reptiles? So is it a COX-1 inhibitor, such as aspirin? Or is it a COX-2 inhibitor, such as meloxicam, or a combo of COX-1, COX-2, such as tepoxylin? Or do we just not know what NSAID is most effective in reptiles? What do you guys think?
We'll give it just a few more seconds here. And there's your results.
All right. It seems like the majority of the audience is saying that we don't know which NSAID is most effective for reptiles. I think you're probably right, except we do know in some specific reptiles. And then the rest of you thought that COX-2 was more effective, and the fewest of you thought that COX-1 or the combo COX-1. Can you put those back up, the results, for a second?
Yeah, sure. Yes, sure can. Sorry about that.
No worries.
There we go.
Yep. So it looks like none of you thought that the combo of COX-1 and COX-2 is most effective. So most of you think that we don't know, which I think you're right. And then COX-2 coming in as the most popular choice. And so very few of you, only one person thought COX-1 is better, and nobody thought the combo is. So I just wanted to review with you some of the information we do know about reptile pain. So we have information on snakes in particular and pythons that they actually express COX-1 primarily in inflamed tissues. So at least from the study that was published in AJVR 2015, that paper was looking at the role of cyclooxygenase signaling pathway in inflamed skin and muscle tissue of ball pythons. And what they found was that, so they actually surgically induced these wounds and then biopsied them. And they found that COX-1 was significantly more increased in inflamed tissue, whereas there was no change in the COX-2 compared to non-inflamed tissue. So at least we can say for ball pythons, COX-1 inhibitors are actually the most effective. And then in another study, where they looked at box turtles. This was a study published in the Journal of Zoo Medicine in 2012, led by Duncan Lascelles. And what they found in that study was that the traumatized tissue, so this was evaluation of cyclooxygenase protein expression in traumatized versus normal tissues in eastern box turtles. And the traumatized muscle was grossly, compared to grossly normal muscle, had significantly greater COX-1, but not COX-2 protein concentrations. So what we know here, again, a little bit similar to what we saw with the pythons, is that traumatized muscle is much more likely to express COX-1. However, they did find that in traumatized muscle compared to normal muscle, there was upregulation of both COX-1 and COX-2. And so, you know, really what we can say from these studies is that the traditional NSAIDs that we use in small animal medicine, which are the COX-2 selective NSAIDs, are probably not effective for our reptile patients. We should be thinking about using either COX-1 selective or potentially ones that do both COX-1 or COX-2. But the reality is that, you know, we just don't know, because there are a lot of different reptiles out there, and we really need to look at each one of the species in order to know for them which is the most effective. So here's another case example of a python that was treated by Dr. Latoya Latney. And this was an egg-bound python that was having a lot of pain and difficulty in recovering. And we did the PEMF treatment that seemed to really make a significant difference in the recovery. So I wanted to share with you information that is intimately familiar to me, because I was involved, well, not involved, I led a prospective clinical trial at the Animal Medical Center using the Assisi loop. And while it's not specific on exotics, I wanted to share it with you because it's prospective clinical data that we often don't have for these modalities that we use in rehab. And again, just so you understand that we do have clinical efficacy. So what I was interested in looking at was dogs that were recovering post-op hemilaminectomy, and I was really interested to figure out if the PEMF treatment would improve postoperative pain, if it would improve wound healing, and I was really hoping it would improve their functional outcomes. So, you know, essentially I was hoping they would start walking sooner. I recruited 60 dogs for the study, so we actually enrolled 60 dogs in the study. 53 of them completed the study. They were randomized into either sham or treatment groups. So the devices looked exactly the same, literally, but one of the sham devices, when you press the power button and the little green lights turned on, it delivered no electromagnetic field therapy, versus the sham device delivered the electromagnetic field therapy, but they felt and looked exactly the same. And so 27 of the dogs have been randomized to receive that targeted PEMF treatment, and the other 28 were in the sham control group. This study was published in the Journal of the American Animal Hospital Association in 2019. And so that you understand a little bit more about the Assisi loop and the treatment that it delivers, it is portable and battery operated. It has that signal that we already spoke about, which is FDA approved at 27.12 megahertz. It has the 2 microsecond pulse duration and the 2 hertz frequency. It also has a peak magnetic field of 4 microtesla. We used to think that it would deliver a type of football-shaped emission where it would sort of taper off the further you got from the circle, but now we know it actually goes out much further than we realized. So it goes out as far as 20 centimeters on either side of the coil. So that's approximately 7.5 inches. And then it does taper off the further away that you are. So that's why you want your patient to be in the center of the loop as much as possible. But realize, for example, if you need to treat the entire abdomen of a patient, let's say for a GI stasis, that it will penetrate through all of those tissues. And also, if you are dealing with a fracture repair or anything that's requiring bandage material, the signal will penetrate through bandages, blankets, pads, anything like that, as long as it doesn't have metal, because it will bounce off the metal. But anything that's soft, it will absolutely go through that. So the summary of my results is that I did find improvement in wound scores 6 weeks postoperatively, and I used 2 different measures for that were actually by a blinded board-certified surgeon that assigned the wound scores. We did not, however, find any statistical difference in pain scores that were administered either by the veterinarians or the owners, nor was there statistical significance in the neurologic scores or in the ability to regain functional tasks. The things we were looking for is return of voluntary urination, ability to stand independently, and ability to walk independently. However, we did find that the CC loop was easy to administer. All owners noted that it was easy to administer, including the nurses that used it in hospital before the patients were discharged, and we did not find any significant side effects. Perhaps the most important finding of my study was that there was a significantly higher number of owner-administered pain medications in the sham group. So the patients that did not get the CC loop, the owners administered more pain medication. And I was really confused, like, well, if they were giving more pain medication, why weren't their pain scores higher? But I realized the pain scores that we use, which was the Colorado State University pain scale, is actually not a validated pain scale. And I think it's just too simplistic, and it didn't capture what the owners intuitively were able to assess, was that, you know, that their pet needed more pain medication. And it was really, really impressive, the difference in the amount of the pain medication administration. So the 2 medications that were sent home was gabapentin and codeine. And codeine was administered almost 2 times more frequently in the sham group compared to the treatment group. So that is really meaningful. I think particularly in our opioid crisis that we're dealing with. This is very much in line with the study. If you remember, I was showing you in the earlier slides with the breast reconstruction surgery, they saw very similar findings with a 50% reduction in narcotic use by these patients postoperatively. So that's really the main takeaway of my study, is that it had significant impact in reducing the amount of oral pain medications that had to be administered. And while I can't say that this would translate to exotics, you know, I think what we can safely say is that it is difficult to treat exotic patients effectively with oral pain medications, again, because we often don't know which medications are most effective or how they work, particularly in our reptile patients. And it can be difficult to administer them. So I think using the CC loop as an adjunctive pain management protocol can really help the management of these patients. Okay, I wanted to end today's talk by giving you some very practical tips and treatment suggestions. There isn't specifically data to support this, but this is really based on experience both by myself and the company to help you in treating your exotic patients. So for your postoperative patients, what I would recommend is placing the loop directly over the surgical site. Remember, the closer it is to the center, the more you're targeting that electromagnetic field. For the acute postoperative period, you should treat them every 2 hours for the first 48 hours. And the company does make a device that will turn itself on and off automatically, so it can just cycle through on its own. Otherwise, you know, realistically, if you're in a clinic and you don't have somebody that can turn it on that frequently, you know, you can do it QID. And that's actually what I did in my study. But then after that immediate 48 hours, I do recommend going to that QID for the next 10 to 14 days. So essentially until suture removal. And then for more chronic inflammatory patients postoperatively, I would continue to treat QID for 10 days until the symptoms improve. So essentially you almost start at that same protocol as an acute patient, and then until they improve, and then start to taper to 1 to 2 times daily treatment. Okay. For your patients with rhinitis or recovering post-dental, place the loop directly over the head and then treat QID for the first 2 days or until the pain improves or resolves or they're eating well. And then again, you can taper off or just stop. For gastric stasis or inflammation in the abdomen, place the loop around the entire caudal abdominal region. So you can just loop their whole abdomen into the loop and then treat QID until the clinical signs resolve or they're eating well. And then you can taper off to twice daily treatments for an additional 3 to 5 days. For more mild cases, so the ones that are, they're eating, but you know that they have some gastric stasis, you can just have them administer the treatment twice daily for a couple of days or until the symptoms resolve. And with that, I just wanted to summarize the main takeaways, which is that we know PEMF is known to increase both wound healing and bone healing. It is effective at reducing soft tissue swelling, edema, and inflammation. Improves pain management, particularly at home, and reducing the number of oral medications that need to be administered. And finally, an opportunity to treat pain in a non-pharmacologic manner that is non-invasive. And with that, I wanted to thank for a lot of these pictures, Dr. Latoya Latney and Dr. Cindy Brown, who are in the exotics department at AMC, and also wanted to thank Assisi for sponsoring tonight's lecture and open it up for questions.
All right, thanks so much, Dr. Alvarez. I do see a couple of questions come through, and we'll give everyone a few moments to post some additional questions. Before we do that, I will remind everybody that you will receive a follow-up email after the presentation within a day or so with your CE certificate and a link to review this recorded presentation in case you missed anything. And we are running some May promotions on the Assisi Loop product line. If anyone would like to give it a try or stock up, we're running a 20% off your total purchase with the completion of a Calmer Canine Lunch and Learn, or 15% off the purchase of 2 Loop lounges on the same invoice. And with that, Dr. Alvarez, we'll go right into the questions. Let's see. First one, can you tell us the time frame on the duck's foot and the GP with the colitis? If I pronounce that wrong, I apologize.
Yeah, the colitis was over, period. It was Dr. Cindy Brown's case. But from my understanding, that took several weeks to recover. For the duck, it was also a few weeks. We saw pretty immediate improvement after the first 2 to 3 weeks because we were doing shockwave. And so after the second shockwave, we already saw really significant improvement where the duck was consistently using the leg. And to get the complete resolution, we were at about six weeks out.
Okay, next question. Have you used PEMF for series issues in birds?
I haven't personally, but I would think that it should help, and so I would definitely try it.
What about fish?
We don't treat fish, or at least I'm not consulted on fish at the AMC, so I do not have any personal experience with fish. But I will say this. Because it is an electrical signal, you would not want to put the loop in water so it can't touch the water. The electrical fields will go through the water, but just realize that they will be dampened because it is an electrical signal. And so it's going to be interfered by the water. So if the fish can handle being outside of the water, that would probably be more effective. But you could also try putting it in a smaller bowl and then putting the loop over the bowl. The signal will transmit it, just it is going to be a little bit dampened.
Okay. Here's a great question. Does the loop affect any cardiac pacemakers?
Ooh, I'm so glad you brought that up. We don't have too many exotic species that get pacemakers placed, but it is contraindicated if you have a patient that has a pacemaker because it is an electromagnetic signal and it will interfere with the pacemaker. So I do actually have over the years have had several dogs that have pacemakers, and we unfortunately are not able to use the PEMF on those patients. We used to give a caution for patients that had seizures or arrhythmias, but there is actually no contraindication for seizures. And if they have an arrhythmia, I just wouldn't put it near the heart. But like if you're treating, for example, a lumbar area, remember that the signal goes up and down from the center of the ring. It doesn't go out sideways. So as long as it's distal to the heart, you could still do that, but I would not risk that with a pacemaker patient. And I will say that for your exotics patients who, most of them are not going to have a pacemaker, it is worthwhile noting, because if the owner has a pacemaker, you would want to advise them to not be near the PEMF while they're administering the device if they themselves have a pacemaker. The other thing too, which is, it's probably not a big deal, but you don't want to put your cell phone right in the center of the loop either, because again, the electromagnetic signals could interfere.
Good question. Okay, good answer. Here's another one. So the loops run for 15 minutes. Do you also run the full cycle on the little critters, the smaller animals and mammals? For example, we use much shorter needle retention times for acupuncture in birds.
Yes, I agree with that. I use fewer needles and shorter time when I do acupuncture on birds. I will say that because the signal, it is such a biologic level, I am administering the full 15 minutes, because we know, for example, that you can administer this every 2 hours cycling through for those acute post-operative periods. And by now, I've literally treated hundreds of exotic patients with the PEMF, and they tolerate it very well. So your standard Assisi loop is going to turn on for 15 minutes, and then it will shut itself off after that 15-minute treatment. And, most of the protocols that I showed you, treating QID is going to work very effectively in the immediate period until you see symptom resolution, and then you can taper down. I really have not reduced that time for the species. It's not a size issue. It's the electrical field which cells are generating, which is not going to be different between species. This is highly preserved across species. This is going back to the beginnings of life. All atoms and cells have these electrical signals, and what we're talking about here is a bioelectrical magnetic field. So it's not high enough to disrupt the normal signaling. It's actually just tapping into and upregulating that signaling. So at least in my experience, I haven't had more success using it less frequently. Quite the opposite. If you have a severe condition, I would give more treatments.
Okay, let's see. Next question. How often have you sent home a loop for various exotics? Most of your examples seem to be hospitalized. And did the client buy or rent the loop?
Yeah, I will say that in all cases that I showed this evening, while they were hospitalized, they went home also, and they did go home with the device. We do sell the device and they take it home. We don't personally rent them. But our exotics department uses a lot of the Assisi loop, including for outpatients. So depending on the condition, for example, if there's a chronic inflammatory condition, or they're recovering, let's say, post-dental, they would go home with that loop.
All right. Okay. Well,